Well, you're watching our special show, Coronavirus Facts versus Myths. Now, let's bring you the latest data. And India's COVID chart continues to show improvement today, with the country recording 1.06 lakh cases. That's a drop of 12% from yesterday's 1.14 lakh infections that were reported to be the lowest in 2 months. The country's caseload now stands at 2.89 crore. But worryingly, the positivity rate has gone up slightly from 5.6% to 6.33% as testing across the country has dropped. Remember, the positivity rate ideally should be below 5%. Now, more than 23 crore vaccine doses have been administered across the country in the mega inoculation plan. However, states continue to face a shortage of the two vaccines currently being used in the country. Now, the big focus on the show today, and we're going to talk about mucormycosis, or as it's being more commonly referred to, black fungus. But it has emerged as a huge challenge to the country after the second wave of COVID. The country at present has nearly 20,000 cases of this serious fungal infection, and the mortality of mucormycosis is much higher than COVID. And an early diagnosis and prompt management is absolutely critical in saving patients. Even now, many weeks after this emerged as a huge challenge, the drugs to treat it remain in short supply. So that is a huge worry, and that's caused a lot of anxiety across the country. Now, two issues that we're going to look at today is how COVID itself is leading to diabetes, which then makes you more vulnerable to mucormycosis, and also about the Delta variant that's dominant in the country. Is it in any way triggering more cases, or is it just because it causes more severe illness, which also still has to be proven? To talk about this, we're joined by Dr. Subhash Wangnu, Head Obesity, Diabetes and Endocrinology, Apollo Hospitals, New Delhi, and Dr. Lancelot Pinto, a consultant pulmonologist and epidemiologist, Hinduja Hospital, Mumbai. Thank you so much, doctors, for joining us on this very, very crucial issue. Dr. Wangnu, first to you, what can you tell us about, this second wave and these cases of mucormycosis that have emerged? They did emerge in the first wave as well, but nothing like what we're seeing now.
Yeah, first of all, we have to pose three important questions to ourselves. Number one, what happened that there was a sudden rise, unprecedented rise of the mucormycosis in the second wave? The second question we had to address, why India? Why India had more cases as compared to the other countries? And third important questions we had to address to ourselves, that is it something to do with the new Delta variant mutant virus in the second wave? Because as compared to the first wave, there has been 100 times more surge in the patient with the mucormycosis. Let's come one by one. Diabetes. Now, the coronavirus, because the ACE2 receptor, which are basically expressed on the beta cell of the pancreas, which produce insulin, and the coronavirus gets entry through the ACE2 receptors and directly get into the beta cell and damage it, which produces the insulin. So there's an insulin deficiency directly because of the coronavirus. This we were seeing before in the first wave also, with that development of new onset diabetes, development of the new onset hyperglycemia because of the coronavirus infection. We know that diabetes disrupts immune defense mechanism. Above all, the coronavirus further exacerbates your immune body system. And third, unjudicious use of steroid for a long time adds fuel to the fire. So these are three broadly mechanisms. Now let's come one by one. What we are seeing, this surge in India, which is not comparable to the other countries, might with this Delta variant has to do something. We have to prove the cause and effect relationship. But this is the most plausible explanation, because we know diabetes was seen before also and now also.
Absolutely, and India is called a ticking time bomb as far as diabetes goes. Dr. Pinto, there's a lot more we need to understand about the Delta variant. Recently, a study in India found that it is more transmissible. A study in the UK, however, suggested that it perhaps causes more hospitalization. So we need a lot more evidence, and also, if that's the reason we're seeing this spike in cases of mucormycosis.
I couldn't agree more, Gargi, and I think most of us clinicians working on the ground have also really realized that this time around we saw a lot stronger immune responses. Individuals tended to have fevers for a longer period of time. I think whether it's judicious or injudicious, I think most of us would agree that more individuals this time around seem to be getting hypoxemic. More individuals potentially needed steroids as compared to the first time round. And I think this seemed to be a pattern across the country. So most of my colleagues will also agree that earlier it was a small fraction of individuals who needed hospitalization or who have these prolonged fevers which lasted up to 10 days. But this time around, we are for some reason seeing a stronger immune response. Now, that may not be reflected necessarily in mortality. Maybe the number of individuals who die as a fraction of the number of cases remains the same. But morbidity, which would suggest hospitalization rates, which would suggest the period of time for which individuals remain sick, I think most of us agree that it does seem to be a little more prolonged this time around compared to the first time.
Right. So Dr. Wangma, I know you spoke about it briefly, but if you could tell us more about how is COVID leading to diabetes, and those who develop diabetes post a COVID infection, does it last long? Is it something that can be managed? Does it go away after a point?
Yeah, you're right that we already know that because of diabetes, the severity of the infection because of the COVID is much more as compared to the non-diabetics. Coming to the cause of the diabetes because of the coronavirus, the possible hypothetical mechanism will be, I told you, it directly enters into the cells which produces insulin, damages it, and it may cause a temporary diabetes, which may resolve over a period of time. It may cause a short period of hyperglycemia, or if the patient is already having pre-diabetes and he's prone to develop diabetes, the coronavirus may cause a permanent type 2 diabetes in this patient. So it is very pertinent because we know that diabetes decreases the body's immunity. Coronavirus also decreases body immunity, and uncontrolled diabetes also decreases the body immunity. So we have to know the first and pertinent important thing is to control your diabetes very well, whether it is with the judicious use of oral drugs or the insulin. And I will tell you, the impact of the coronavirus on the persistence of the blood sugar abnormalities may last for a longer period of time. We have seen patients having persistent elevated blood sugar even after 3 months of recovery from the COVID. And that may be because of some genetic predisposition, or the patient might be not diagnosed as having diabetes before COVID, or they might be having pre-diabetes. So this is the most important thing, that the coronavirus is triggering factor for the development of the abnormal blood sugar values, which is a critical point for the immune response. And we know the immunocompromised patient, the coronavirus, which further disturbs the immunity, it may damage the tissues and cause entry of the fungal infection in the damaged tissues.
Right. Dr. Pinto, now so many weeks later, or since this has emerged in the second wave, we're still finding such a challenge in treating it. There's still a shortage of the drug, that is being used to treat it. More drugs are being talked about. What can you tell us? And this is causing so much anxiety and heartbreak for families.
A recent study, which was possibly one of the first studies which was published from 16 participating centers across the country. It was just published in the CDC's journal, which is called Emerging Infectious Diseases. They found that 62% of all the individuals who had mucor had uncontrolled diabetes, and 20% of them were newly detected. So they weren't aware of the fact that they had diabetes, and this was the first time they were detected. Of those who didn't have any other comorbidities, a significant chunk of them, about 79% of them, received glucocorticoids. Even in this series, the 12-week mortality was about 45%. So 45% of individuals did not make it at 12 weeks, suggesting that even in the early phase, when possibly the drug shortages weren't as manifest as they are right now, despite having the drugs available and the surgeries conducted, it is a disease which leads to a high degree of mortality. I think the recurring theme remains the same. As long as you keep your sugars well controlled, as long as you make sure that steroids are not used injudiciously, so they should be used only when a person's oxygen levels dip, and if they are used generally, most individuals need it for up to a maximum of 10 days, not beyond that. I think if we just stick to these principles, we would prevent a majority of the cases. Because as you rightly said, once they do occur, treating them is extremely challenging, and we unfortunately lose a lot of patients despite the best measures.
All right. Well, thank you so much, Dr. Wangnu and Dr. Pinto, for joining us on this very, very important subject.
Thank you.
Now, as COVID cases across the country are witnessing a drop, several Indian states have started to relax lockdown curbs as coronavirus infections are subsiding. But authorities need to remain alert if we're to prevent another wave, because remember, the COVID is still very much there. Well, to talk about the India situation as well as the situation in the United States, we're joined by Dr. Kritika Kupali, Assistant Professor of Medicine at the Medical University of South Carolina and an expert on emerging infections and outbreak preparedness. Thank you so much for joining us on the show. Now, India's COVID cases are on a firm downward trend, but as I mentioned, this comes as many states are now reopening after a lockdown. So the next few weeks are going to be crucial, isn't it?
Yeah, that's a very good question. I think that the lockdowns were important to help stop the chains of onward transmission, which it looks like they have helped as we've seen cases decrease. However, as we start to open up again, we're going to have to keep an eye on the case counts and what happens. And so it will be very important for people to continue to adhere to those important public health measures we've been talking about for the last year and a half. So wearing their face masks, trying to physically distance as much as possible, which can be very challenging in India, and making sure that they're trying to get vaccinated when they are able to. I think all those things are going to be really important. And most importantly, if they're sick, to stay at home and not go out in public. And so we'll keep a close eye on things as they reopen society and see what happens to case numbers and what happens at the hospitals. That will be important to see.
Now, recently in the UK, a study has said the Delta variant may be causing more hospitalizations. But so far in India, we have a study that says it's more transmissible, but we don't know for sure if it causes more severe disease.
Yes. So it does look like that the Delta variant is more transmissible. And so what can happen when you have a disease that's more transmissible is then you have more and more people becoming infected. And as you have more and more people becoming infected, we know that that can increase the burden on hospitals and then potentially also lead to more deaths, right? And so that's, again, why it's so important for people to get vaccinated when they can get vaccinated, because we want to really protect those high-risk individuals who are at greater risk from getting COVID and then subsequently having adverse complications such as death. And so it does make sense if we are seeing some increased transmissibility that correlated with that, we are seeing more deaths because we're seeing more people getting infected.
Now, the pace of you spoke about vaccines, so the pace of our vaccination drive is a huge worry. And recently, again, there was a study that claims that Pfizer vaccines are less effective against the Delta variant. It also called for reducing the gaps between doses. So this is a worry for us.
Yeah, so I think the data coming out in Lancet is definitely concerning. And I think what we've seen, given the Delta variant, it's really important that we speed up our vaccination campaigns and that we adhere to the science that was done in the clinical trials. So, I think it's important that we try to maintain the duration between the doses. We try and roll out the vaccines to those particularly at the highest risk. So those who are on the front lines in the hospitals. I know that there have been a number of healthcare worker infections and deaths. I think the highest risk populations, those over the age of 60 with comorbid conditions in particular. So I think that's really important. And I think that the data coming out about the vaccines makes it even more important that people are getting at least 2 shots of the vaccine to get the most protection that they possibly can. So doing it as quickly as possible and getting at least 2 of those doses. And then, there's talk about down the road possibly needing a booster as well.
Now, we do know the vaccination drive in the U.S. is moving quite rapidly, and President Biden announced they want to vaccinate 70% of adults with 1 dose by July.
Yeah, so, things in the U.S. have been looking better. So we have vaccines have been really pushed out quickly. And we're really at a point now where the supply of vaccines is really exceeding the demand. And so we're really trying to reach out with vaccines to communities that have been difficult to access, communities they may be hesitant about the vaccine, to try and get them to take up the vaccine. But we really are in a situation now where we have more vaccine than there's demand for. And I think, one of the things that we've been talking about is the importance of sharing those extra doses of vaccines to the rest of the world. So places that are seeing surges, such as India, such as Brazil, parts of Africa that are seeing surges, and also donating those doses to COVAX. I know the Biden administration made a first step in that last week with giving 25 million doses, but we need to do more.
Now, I know that you've been advocating for sharing of vaccines with other countries and how, we're not all safe unless everyone is safe.
Yes, absolutely. I think that if the repeated theme of this pandemic has been that what happens in one part of the world affects the rest of the world. And that can go back even to the beginning of the pandemic when we were just seeing cases in China. And so, infections don't have boundaries, they don't have borders. And so even though things are starting to look better here in the United States, we really do need to think about the rest of the world, what's going on in Latin and South America, what's going on in Southeast Asia, what's going on in Africa, because those variants that we're seeing, they're going to continue to pop up. We're going to see more variants unless we get the rates of transmission under control and are able to stop rates of transmission. And that's going to happen by rolling out vaccine as quick as possible, but also by encouraging uptake of these public health measures. And by doing that, then we can try and get everybody vaccinated. And then, as you mentioned before, we are not all safe until the entire world is safe. And that really needs to be the focus of ending this pandemic, is trying to get everybody across the finish line, not just one nation, high-income countries. It's really the entire globe across the finish line.
All right. Thank you so much, Dr. Kritika, for joining us here on NDTV. Well, with that, time for us to slip into a short break. On the other side, we'll take a look at some of the frequently asked questions about COVID and vaccines. Stay with us. Now, for our special campaign, Vaccinate India, in partnership with Google, and we're discussing questions you may have about vaccines, questions that you look up online, that you often Google. And with us, we have Dr. Pinto, Dr. Lancelot Pinto, back with us to answer those questions. Well, Doctor, one of the questions that gets looked up a lot is, how can I prevent COVID? So besides, of course, getting vaccinated, how can one prevent COVID?
I think the messaging as far as that is concerned has remained very consistent over the past 1 year. So it's avoid the 3 C's. So avoid closed spaces, avoid crowded spaces, and avoid close contact with individuals. That's how COVID essentially spreads the most. So you would want distancing, you would want masking, and you want hand sanitizing. These are the 3 things that work in favor of you preventing the disease. What has changed slightly is the fact that it may also be airborne now. We earlier thought it was only droplets, so distancing alone was enough. Now we realize that just distancing alone may not be enough, especially if it's a closed space, which is closed with air conditioning, without adequate ventilation. So I think ventilation is an added aspect to this. And of course, the most powerful way to prevent COVID, or prevent severe COVID at least, is vaccination.
Absolutely. And this ventilation, if you could just talk a bit more about it, because that, as you said, has really emerged as one of the key issues, one of the key, ways to prevent it, ensure that you're either outdoors or in very well ventilated environments. And now with, parts of India opening up, this is going to be a big challenge and something that needs to be looked at very closely, isn't it?
So the assumption earlier was that it's spread only through droplets. So droplets tend to be heavier and they're produced when a person coughs, sneezes, or breathes. And because they are heavier, they settle down to the ground really rapidly. So as long as you maintained a distance between 2 individuals, the probability of those droplets hovering in the air was very low. We now know that that's not necessarily true. So those airborne particles can remain in the air for some time. And as long as the ventilation is inadequate, those hovering particles in the air have the potential of transmission. So when we go into closed spaces, for example, an elevator which is closed, for example, an air-conditioned or a centrally air-conditioned space where the air exchanges aren't that efficient, the possibility of transmission can occur even after the person has left the room, or even if the person is 6 feet away. So I think in these circumstances, one needs to be sure that there are masks even indoors. One needs to rethink things like whether you want to use an air-conditioned mode of travel, for example, public transport in an air-conditioned mode, versus public transport in an open air mode. I think the open air one would be better. So an auto rickshaw is possibly better than an air conditioned cab. So I think we need to rethink some of those measures and make it more efficient at preventing transmission.
And can improving immunity help you prevent getting COVID?
I mean, simple measures like improving your sugar control, keeping your comorbidities under control. So if you have high blood pressure, if you have heart disease, making sure that you take your medications regularly. If you have underlying respiratory illness, for example, if you have asthma, this is not the time to default on your inhalers. This is the time you need to be absolutely regular, so that if you do get COVID, you're at a better position. You will not deteriorate that rapidly, or your reserves will be intact such that you will be protected. Apart from that, boosting immunity in any way, I don't think there's any proof to suggest that you can take supplements or any other drugs that would prevent it.
But just promote your overall health. I suppose another question that gets Googled a lot is COVID vaccine side effects. Many people want to look that up. What would you say about side effects?
So for most individuals, the side effect is fever. That's possibly the commonest side effect that most individuals experience, along with pain at the site of injection. There tends to be body ache for a couple of days. There tends to be a sense of malaise, a sense of fatigue that happens in some individuals for a day or two. But for a majority of individuals, that's about it, 2 or 3 days of these symptoms. In some individuals, the fever does get prolonged for 4 or 5 days. In some individuals, the fatigue tends to be longer. But more severe adverse effects, such as having strong allergic reactions or having these blood clots that people seem to be concerned about, are extremely, extremely rare. And for most individuals, the potential benefits of the vaccination will far outweigh the potential risks associated with it.
Right, because if we talk about blood clots due to the coronavirus disease, many people are developing blood clots. So that's something we want to avoid.
Exactly. So if you have risk factors, if you have heart disease, if you have high blood pressure, if you are obese, these are strong risk factors of getting moderate to severe disease. So if a person with that profile does acquire the infection, the probability of them having moderate to severe disease is much, much, much higher than the clots, which happen in a minuscule proportion of individuals who receive the vaccine. So I think the benefit clearly outweighs the risk in that kind of a situation.
Absolutely. Thank you so much, Dr. Pinto, for joining us and answering those questions.
Thank you for having me.
Thank you.